everyone. My name is Angel Roca, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share updates on COVID-19, our latest resources and guidances, and to answer questions submitted by you, our partners. On today's call, we will provide an update on what we know about post-COVID conditions, a presentation on the National Month of Action, and as we prepare for summer, updates on vaccination and travel. First, we will hear from an author of new guidance for health professionals on caring for patients with post-COVID conditions. Then we will hear from two experts working in the COVID-19 response on the different initiatives occurring across the country during the month of action and the benefits of being fully vaccinated before travel. Then our speakers will answer questions we received over the last week via email. If you experienced technical difficulties or otherwise would like to review today's call, you can find the recordings on cdc.gov and YouTube in 8 to 10 days. All past partner calls can be found there, so please take your time to review and share prior recordings. For more information about these webinars, visit our COVID-19 partner call webpage, where you can register for future partner calls and see recordings of previous webinars. If this is your first webinar with us, welcome. Please see the link in the chat to subscribe and receive future call invitations. Please note, this call is not intended for media, although we welcome the media who may be here today. Should you be a reporter and have questions, we invite you to reach out to media@cdc.gov. These calls are designed to share the latest science, guidance, and resources from CDC. CDC issues thousands of resources and guidance materials for individuals, businesses, and the public on our website, cdc.gov. Here are some of the highlights on just a few of our recent web editions. First, a new CDC study released on June 7th, 2021, finds the mRNA COVID-19 vaccine authorized by the Food and Drug Administration, Pfizer and Moderna, reduced the risk of infection by 91% for fully vaccinated people. The findings come from 4 weeks of additional data collected in CDC's HEROES Recovery Study of healthcare workers, first responders, frontline workers, and other essential workers. These groups are more likely to be exposed to the virus that causes COVID-19 because of their occupations. Of those who became infected after being fully or partially vaccinated, findings indicate that they were more likely to have a milder or shorter illness and spend on average 6 fewer total days sick and 2 fewer days sick in bed. Second, throughout the COVID-19 pandemic, older U.S. adults have been at increased risk for severe COVID-19 associated illnesses and death. Recent studies since COVID-19 vaccinations began in the United States in December 2020 have shown that emergency department visits, hospital admissions, and death decline more in older adults who had higher vaccination coverage than in younger adults who had lower vaccination coverage. And third, CDC released updated guidances on May 28, 2021 for operating youth camps, which can play an important role in the lives of children, including supporting their social, emotional, and physical development. This guidance is intended for all types of youth day and overnight camps. The guidance outlines strategies that camp programs can use to help maintain healthy environments and operations, lower the cost of COVID-19 spread in their programs, and prepare for when someone is sick with COVID-19, providing support, coping, and resilience. Welcome to today's panelists, Dr. Jennifer Chevinsky from the Epidemic Intelligence Service Officer, Health Systems and Worker Safety Task Force, Dr. Jennifer Layden, a co-lead for the Vaccine Task Force, Dr. Allison Taylor Walker, Epidemiology and Surveillance Lead, CDC's Travelers Health Branch. Welcome all. Now I'll turn it over to Dr. Chevinsky, who will present on post-COVID conditions. Dr. Chevinsky.
Thank you, Angel, and welcome to everyone joining us today. My name is Jennifer Chevinsky, and I'm a preventive medicine physician and an EIS officer serving with the Health Systems and Worker Safety Task Force within CDC's COVID-19 response. Today, I'd like to provide an update on newly released interim guidance on evaluating and caring for patients with post-COVID conditions. Next slide, please. Information in this guidance is based on medical expert opinion, feedback from U.S. medical associations and patient advocacy groups, and the best currently available data. Today, I'll be providing you background on post-COVID conditions, general considerations for healthcare providers on evaluation and treating patients with post-COVID conditions, and the future directions of continued research on this topic. More detailed information can be found on the CDC website. Next slide, please. In this section, we'll talk more about post-COVID conditions. Thank you. Post-COVID conditions, informally known as long COVID, is an umbrella term for the wide range of physical and mental health problems that occur 4 or more weeks after first being infected with COVID-19. Even people who had mild symptoms or who did not have any symptoms when they were infected can have post-COVID conditions. And the CDC is currently working with government, academic, and community partners to better understand the long-term effects of COVID-19. Next slide. Post-COVID conditions can present themselves differently. These conditions can have different types and combinations of health problems for different lengths of time. We've identified several patterns so far, including persistent symptoms, new symptoms that can occur much later after the initial infection, and symptoms and conditions that change over time. The different symptoms and conditions could be caused by different underlying processes. And different factors can complicate the signs and symptoms of post-COVID conditions, including underlying medical conditions, other health issues related to a potentially life-threatening illness, or more general effects from the pandemic. Post-COVID conditions may also share similarities with other post-viral conditions, such as myalgic encephalomyelitis, chronic fatigue syndrome, dysautonomia, or mast cell activation syndrome. Next slide, please. Post-COVID conditions may affect millions of Americans. The frequency varies widely in the literature from 5% to up to 80%, in part due to using different definitions, different criteria, and different data sources in different settings. Evidence suggests that post-COVID conditions occur in children, adolescents, and adults. And we also face challenges estimating the prevalence of post-COVID conditions in subgroups that could be at higher risk. Next slide. Post-COVID conditions are associated with a spectrum of physical, social, and psychological consequences, as well as functional limitations that can present substantial challenges to patient wellness and quality of life. There are many types of post-COVID symptoms, and some of the most commonly reported ones include fatigue, brain fog or cognitive impairment, shortness of breath, cough, chest pain, headaches, loss of smell or taste, burning or prickling that's usually felt in the hands, arms, legs, or feet, stomach pain, diarrhea, fever, insomnia, muscle pain, joint pain, mood changes, lightheadedness, heart palpitations or abnormal heart rhythm, menstrual cycle irregularities, rashes, and symptoms that get worse after physical or mental activities, also known as post-exertional malaise. Next slide, please. So what are some general considerations that healthcare providers can keep in mind while treating patients with post-COVID conditions? While most of our audience today are not healthcare providers, the information is also useful for businesses, schools, and other partners, as your organizations may interact with people with post-COVID conditions, and it could be a helpful resource. The most important consideration is that healthcare providers listen to and validate patients' experiences, recognizing that symptoms and conditions could substantially impact a patient's quality of life, functioning, and ability to return to school or work. Healthcare professionals should partner with patients to identify achievable health goals, setting expectations with patients and their families that outcomes from post-COVID conditions differ among patients, and with transparency that there's much more to learn about post-COVID conditions. Most post-COVID conditions can be identified and managed by primary care providers, and a patient-centered medical home model could be helpful with coordinated, comprehensive care and open communication among a core group of specialty care providers and support services, like occupational therapy, physical therapy, and social work, to maximize functional improvement and rehabilitation efforts. Healthcare providers might also consider referring patients to post-COVID care clinics, where they're available and accessible. Many post-COVID conditions may be diagnosed just based on history and physical examination, while others might require directed diagnostic testing, with the understanding that potential harms could arise from excessive testing, such as increased risk for incidental findings, imaging-related radiation exposure, and cost. And lastly, any symptoms persisting beyond 3 months should prompt further evaluation. Next slide, please. So now I'll go into our next steps for the continued work on post-COVID conditions. Next slide, please. The documentation of post-COVID conditions is critical for accurate public health surveillance. The World Health Organization has recently developed medical coding guidance for healthcare encounters related to post-COVID conditions. The medical code is not currently available in the US, and it's currently under review. But in the meantime, the CDC recommends healthcare providers use B94.8, sequelae of other specified infectious and parasitic diseases. Next slide, please. Researchers are working to define the time periods in which symptoms would be related to long-term or short-term illness related to COVID-19. CDC has partnered with NIH to align our efforts within the federal government. And we're also continuing to work with our partners at the federal, state, local level, and with academic and community partners. Lastly, the current knowledge we have of post-COVID conditions is likely to change rapidly with ongoing extensive research. We will continue to keep you informed as this research develops. And you can find more information about post-COVID conditions, including this new interim guidance, on the CDC website. Next slide, please. I'd like to take some time to highlight the acknowledgements for those who contributed to this interim guidance. Next slide, please. Listed here are the authors of this guidance, along with the different external experts, medical associations, and patient advocacy organizations who supported the development of the guidance on post-COVID conditions. We're very appreciative for their efforts. Next slide, please. Thank you for having me today to share this interim guidance on post-COVID conditions with CDC's partners. With that, it's now my pleasure to hand the call over to my colleague, Dr. Layden from the Vaccine Task Force. Thank you.
Thank you, Dr. Chevinsky. Good afternoon. My name is Jen Layden, and I am a co-lead of the Vaccine Task Force within the CDC's COVID-19 response. Today, I'm going to talk about some of our work around the National Month of Action. We all know that getting a COVID-19 vaccination can help protect you from getting COVID-19, and recent data shows that the vaccines may help keep people from spreading COVID-19 to others. We want everyone to be able to go into and continue into the summer, to be able to travel, visit with friends and family, socialize and take part in camps, events, and sports, with the peace of mind that they are protected and that they don't risk spreading COVID-19 to others. Next slide, please. CDC, the federal government, states, and territories are working toward the goal of ensuring that 70% of adults 18 years of age and over have had at least one dose of COVID-19 vaccine by July 4th. As part of this goal, we are building on local successes to increase equitable access of vaccines, and we are focusing on 3 areas. 1, continuing to expand access to communities. 2, reaching those who are interested in getting the vaccine once they have more resources and information. And 3, sharing key messages about the benefits of COVID vaccine. Getting a COVID-19 vaccine is fast, easy, and free. Vaccines are now widely available, and anyone living in the United States can get a free COVID-19 vaccine. You do not need health insurance to get a vaccine, and you will not be asked for your immigration or residency status. COVID-19 vaccines are safe and effective. These vaccines have received and continue to undergo the most intensive safety monitoring in US history. COVID-19 is still a threat to people who are unvaccinated. Some people who get COVID-19 can become severely ill, which could result in hospitalization, and some people have ongoing health problems several weeks or even longer after getting infected. Even people who do not have symptoms when they're infected can have these ongoing health problems. You should be vaccinated regardless of whether you already have had COVID-19. Experts do not yet know how long you are protected from getting sick again after recovering from COVID-19. CDC, the federal government, states and territories, pharmacy partners, as well as many others are working to ensure everyone has access to these safe and effective vaccines. If you, your family, or friends need help accessing a COVID-19 vaccine, you can go to vaccines.gov or ask your local pharmacist or wherever you get your healthcare for more information. Next slide, please. We'll next provide a high-level overview of the month of action. Through July 4th, the We Can Do This campaign is mobilizing national organizations, community-based partners, influencers, celebrities, athletes, and thousands of volunteers across the nation to empower their communities and get vaccinated. This month-long effort is intended to move more people to action by raising awareness about how easy it is to access COVID-19 vaccines, make it easier for people to access the vaccine, and providing incentives for people to get their vaccines. Next slide, please. I wanted to provide some examples of month of action access and promotion activities. Some examples of ways that partners are making it even easier to get vaccine include providing childcare, extending pharmacy hours, and bringing vaccines to where people are, such as barbershops, baseball games, NASCAR races. We are working hard to make sure that everyone knows the importance of getting vaccinated. This includes a national vaccination tour with the Vice President throughout the South and the Midwest. Many groups are canvassing, texting, and phone banking in areas with low vaccination rates. Many local organizations are coordinating vaccination events. Next slide, please. Communities across the nation are responding to the call of action. More than 50 mayors are competing to boost vaccination rates through canvassing, partnerships, and incentives. More than 230 colleges and universities have committed to take action to get students and communities vaccinated. Businesses all over the country are stepping up to provide incentives to the public and employees. Examples of incentives we have seen include childcare providers watching kids for free while parents go get their shot, vaccines at barbershops, baseball games and NASCAR races, pharmacies that are open 24 hours on Fridays, and businesses like Anheuser-Busch, Kroger, and United Airlines are stepping up to offer all adults free beer and drinks on July 4th, the chance to win $1 million and free first-class flights. Next slide, please. We are making a lot of great progress towards the July 4th goal, but still have a lot of work to do. This slide provides some summary data, and please note that the data on this slide are a little bit old. As of Thursday, June 17th, 2021, over 175 million people, or 53% of the population, have received at least one dose. Overall, over 314 million doses of vaccine have been administered. In total, 53% of the population has received at least one dose. In total, 44.5% of the population has been fully vaccinated. Among the population 18 years of age and older, roughly 65% of the population have received at least one dose. 12 states have already given at least one shot to 70% of adults, and more than 28 states in the DC have fully vaccinated 50% or more of their adult populations. But millions of Americans still need protection against the virus. Next slide, please. We are using a multi-pronged approach to support jurisdictions to continue to build on the successes to date. This approach includes addressing additional needs, such as vaccine supply, vaccine access, demand, as well as staffing. We are understanding that there are unique local needs across different settings and communities, and we are leveraging federal as well as local resources to support equitable access in communities. Next slide, please. Some of the strategies that have been identified to support local communities include ensuring that supply is not a problem, using redistribution strategies to ensure local access where it's needed, identify opportunities for federal and other partners to help support access at the local level, provide communication support, support mobilizing communities to get vaccinated, addressing mis and disinformation and generating demand in communities, overcoming challenges to use the data for local access, and addressing staffing challenges. Next slide, please. We are often asked what jurisdictions can do. Jurisdictions can do multiple things to help support this month of actions. They can use local data to refine local strategies, such as identifying metro, urban versus rural strategies. They can engage community partners. They can continue to enroll primary care providers and ensure that they get vaccine to administer. They can leverage national communication efforts at the local level. They can communicate with CDC and other federal agencies. An example of a vaccine success can be seen in Puerto Rico, which has provided completed teacher and school staff vaccination ahead of schedule. The Puerto Rico Department of Public Health partnered with the territory's National Guard, local universities, healthcare partners, and local government agencies to rapidly establish multiple vaccination centers across the island. For this mission, 8 dedicated vaccination sites were established and 12,000 vaccine doses were all set up for the next 6 consecutive weeks of vaccinating school employees. On January 18th, 2021, vaccination of school staff began, and within the first 2 weeks, over 16,000 educators received their first dose. At the beginning of March 2021, President Biden asked US states and territories to prioritize COVID-19 vaccinations for teachers to ensure children could return to school quickly and safely. By the end of March, 98% of school staff in Puerto Rico were fully vaccinated. Next slide, please. In closing, CDC and the federal government's end goal has always been to vaccinate everyone against COVID-19. We will continue to provide focused support to jurisdictions as we work to reach the president's goal of ensuring 70% of adults have 1 or more COVID-19 vaccine shots by July 4th. Over the summer and into the fall, CDC and jurisdictions will be taking a multi-pronged approach to increase demand and vaccine coverage that leverages the strong foundation states, local, tribal, and territorial health departments have already created. We are committed to working together and doing everything we can to get the country past this pandemic and to return to normal. Thank you for having me here today to present on the National Month of Action. And now I'd like to hand it over to my colleague, Dr. Walker. Thank you.
Thank you, Dr. Layden. My name is Allison Taylor Walker, and I'm the Epidemiology and Surveillance Lead within the Travelers Health Branch at CDC. I'm glad to be here and very grateful for the opportunity to speak with you all today. In this presentation, I'll be discussing domestic and international travel during COVID-19 and the importance of getting fully vaccinated against COVID-19 before traveling. Next slide, please. On this graph, we can see the 3 major COVID surges that have occurred in the United States. We can see that each surge has followed a holiday where travel has increased. So travel has likely contributed to these COVID-19 surges. Next slide, please. This graphic shown on the slide is from the New York Times in February of 2020, and it highlights in the first months of the pandemic how drastically travel has decreased as the borders began to close. Next slide, please. But recently, travel has picked up again. A survey in early May 2021, conducted by destination analysts of over 1,200 American travelers, showed that 77% were either already traveling or ready to start traveling. This slide shows a significant decrease in the number of people at TSA checkpoints from 2019 to 2020, and the increase from 2020 to 2021. Passenger numbers continue to increase, and TSA screened over 2 million people yesterday on June 20th. Next slide, please. There are many examples of tools that have been used to try to reduce travel-associated transmission of COVID-19. They include border closings, testing, quarantine, and vaccine, to name a few. Some of these tools work better than others. For example, data have shown that temperature and symptoms screening at airports detected few COVID-19 cases and required considerable resources. The yield was approximately 1 case for every 85,000 travelers screened. Due to the nature of the disease, many people who spread the virus are not symptomatic, and temperature and symptom screening were not effective. On the other hand, we do know that vaccinations are highly effective, and fully vaccinated travelers are less likely to get and spread COVID-19. Next slide, please. When thinking about risk related to travel, it's really important to separate risk at your destination and your individual or personal level of risk. At the destination level, some things to think about include the COVID-19 case rates, testing, health availability, variants of concern, and the proportion of the population who are vaccinated. At the individual level, you can personally consider for your situation. Are you fully vaccinated? If you aren't fully vaccinated, can you get tested or stay home after travel? Are you likely to get severe disease due to your age or health status? And how likely are you to wear a mask, keep distance from others, and avoid crowds at your travel destination? Next slide, please. We've seen positive signs emerge as more people get vaccinated. In Israel, the increasing percent of the population fully vaccinated correlated over time with the decreasing daily number of new cases. This may be because fully vaccinated people are at low risk of symptomatic and severe COVID-19, or because fully vaccinated people are less likely to have asymptomatic infection or transmit SARS-CoV-2 to others. Next slide, please. This graph shows the increasing vaccination coverage, both at the origin and destination, leads to reduced infection and transmission risk for travelers. The science is clear. Vaccines are an important tool for making travel safer, and fully vaccinated travelers are less likely to get and spread COVID-19. Next slide, please. Travelers should still check out the situation at their destination. And even if you're fully vaccinated, pay close attention to the current situation at your destination before traveling internationally. The Travel Health Notice System is a great place to start. COVID-19 travel recommendations can be found on an interactive world map showing COVID-19 travel recommendations by destination. The Travel Health Notice provides travelers information about the COVID-19 situation in destinations around the world. Shown here is a Travel Health Notice for India, which is at the highest, a level 4. And it indicates that travelers should avoid all travel to India. Similar information from many destinations can be found at the link on this slide. Next slide, please. We all want to be able to return to travel this summer, and vaccination is the key to doing that safely. For travel within the United States, fully vaccinated travelers do not need to get tested for COVID-19 pre and post-travel, or to self-quarantine after travel. CDC recommends that those who are not yet fully vaccinated get tested 1 to 3 days before travel, 3 to 5 days after your journey, and quarantine for 7 days if you get tested, and for 10 days if you don't get a test post-journey. Everyone, vaccinated or not, should self-monitor for symptoms, wear a mask while using public transportation and at transportation hubs like airports, and take other precautions while traveling. Next slide, please. For international travel, fully vaccinated travelers no longer need to get tested before outbound travel unless their destination requires it. And also, they no longer need to self-quarantine after travel. However, both unvaccinated and fully vaccinated international travelers must still show proof of a negative viral test or documentation of recovery before boarding a flight to the United States, and should still get tested 3 to 5 days after travel. International travelers should continue to follow all requirements related to testing, mask wearing, and quarantine in their destinations. And this is the end of my presentation. Thank you again for allowing me to share this guidance as we head into the summer travel season, and to explain why vaccines are the key to returning to travel.
Thank you, Dr. Walker. Dr. Chevinsky and Dr. Leighton, thank you so much for those presentations. For those of you who submitted questions in advance of this call, thank you. We received many excellent questions, and we will try to get to as many as we can today. We'll start off with Dr. Chevinsky. The first questions are addressed to you. First question: how likely are people to develop post-COVID conditions?
Thank you for that question. Actually, estimating the percentage of people with post-COVID conditions is quite difficult, and that's because research is relatively new in this area. Most recent research suggests that roughly 10 to 20% of people are reporting post-COVID conditions. However, there are studies that range from 5% of people to up to 80% of people, depending on the study methods and the setting. So additional research is needed in order to better understand the prevalence, and that research is ongoing. Based on the research that has examined post-COVID conditions, most people with post-COVID conditions often start developing long-term effects of COVID between 1 month and 4 months after a COVID infection. CDC continues to work to identify how common these longer-term effects are, who's most likely to get them, and whether and when symptoms resolve. Multi-year studies are underway to further investigate post-COVID conditions, and these studies will help us better understand the frequency of post-COVID conditions and help us understand how to best treat patients with these longer-term effects.
Thank you. Next question. Are post-COVID conditions always severe?
Thank you for that question. The personal experience of long-term effects after COVID-19 are real and different for each person who experiences them. People can experience different combinations of symptoms, degrees of severity, and some of these symptoms and conditions may resolve over time. In a recent study conducted by CDC, 7% of adults experience at least one of the following post-COVID conditions or symptoms, which include respiratory or lung-related symptoms like shortness of breath, abdominal pain, or other digestive or abdominal symptoms like diarrhea, chest pain, symptoms related to the nervous system or in the brain like altered mental status, headache, including migraines, circulatory or heart symptoms like an increased heart rate or heart palpitations, fluid and electrolyte disorders like a low potassium level, general discomfort, malaise or fatigue, nausea and vomiting, and urinary symptoms. So there are multiple different kinds of symptoms, and the experience can be unique to each person who experiences it.
Thank you. Next question. How can I prevent myself from developing post-COVID conditions?
Sure. The best way to prevent post-COVID conditions is by getting vaccinated against COVID-19 as soon as you can. COVID-19 vaccination is recommended for all people 12 years and older. And if you're not fully vaccinated, then you should take everyday actions like wearing a mask, avoiding crowds, and other sort of activities, washing hands, to protect yourself from getting the virus that causes COVID-19. But COVID-19 vaccination should be offered to all eligible people, regardless of whether they had a COVID-19 infection, and including individuals who experience post-COVID conditions. And although so there have been reports of people experiencing an improvement of their post-COVID conditions after vaccination, research is still ongoing to verify this effect and these reports to better understand that report that we've been hearing.
Thank you, Dr. Chevinsky. The next set of questions are for Dr. Leighton. First question. What level of collective, also known as herd immunity, would CDC consider realistic to reach by the end of this year?
Thanks for that question. Population immunity means that enough people in a community are protected from getting that particular disease because they've either already had the disease or because they've been vaccinated. Population immunity makes it hard for the disease to spread from one person to another, and it even protects those who cannot be vaccinated, like newborns or people who are allergic to the vaccine. The percentage of people who need to have protection to achieve this population level immunity varies by disease. For COVID-19, we are still learning how many people have to be vaccinated against this virus before the population can be considered to be protected. As we know more, CDC will continue to update our recommendations for both the vaccinated and unvaccinated people.
Thank you for that. The next question. What current approach do you recommend for the remaining unvaccinated population?
Thanks for that question. The United States Department of Health and Human Services COVID-19 Public Education Campaign, We Can Do This is a national initiative to increase public confidence in and uptake of COVID-19 vaccines while reinforcing basic prevention measures such as mask wearing and social distancing. Through a nationwide network of trusted messengers and consistent fact-based public health messaging, the campaign helps the public make informed decisions about their health and COVID-19, including steps to protect themselves and their community. The effort is driven by communication science and provides tailored information for at-risk groups. The campaign supports efforts of the CDC and others across HHS to use education to improve health. Communication products and initiatives are designed to help those in the movable middle, meaning people who want to protect their health but still have questions about their vaccines, becoming more willing to consider vaccine. The We Can Do This campaign aims to connect with Americans from a wide range of backgrounds. While the campaign aims to build confidence in vaccine, it also reinforces basic message about prevention and treatment of COVID-19 and flu. For more information, please visit COVID-19 Public Education Campaign at wecandothis.hhs.gov. Thanks.
Thank you. Next question. Is the booster vaccine on the radar or anywhere near it for those who say had COVID-19 last year or got their shot early on? And how many months later would they recommend getting a booster after the first shot or after having had COVID?
Thanks for that question. At this time, we do not know how long any of the currently authorized COVID-19 vaccines protect you from getting COVID-19. We also do not know if people will need to get a booster dose later, but this is something the manufacturers and NIH are studying.
Thank you. Next question. How do we return to work and school while keeping everyone safe?
Great question. Fully vaccinated people can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidances. Although fully vaccinated persons do not need to wear masks, schools can be supportive of staff or students who choose to continue to wear a mask. For unvaccinated people, including children 2 years and older, masks should still be worn in addition to staying at least 6 feet apart, especially when indoors around people who don't live in your household. Unvaccinated persons should wear masks to completely cover the nose and mouth and fit snugly against the side of their face without gaps. Masks are still required of all people on planes, buses, trains, and other forms of public transportation traveling into, within, or outside of the United States and in U.S. transportation hubs such as airports and stations.
Thank you. Many of us who have been vaccinated with the J&J vaccine see a lot of guidance and promising headlines, seemingly based entirely on real-world results in data about the mRNA vaccines. What does the CDC have to provide more data about real-world efficacy and results, specifically for the J&J vaccine, to ease our minds?
All COVID-19 vaccines currently available in the United States are effective at preventing COVID-19, as we've already seen in clinical trial settings. Some people who are fully vaccinated against COVID-19 will still get sick because no vaccine is 100% effective. Experts continue to monitor and evaluate how often this occurs, how severe their illness is, and how likely a vaccinated person is to spread COVID-19 to others. Most vaccine effectiveness data now available are related to the mRNA vaccines because these vaccines have been around available longer. CDC and other experts continue to study the effectiveness of both mRNA vaccines and the J&J vaccines in real-world conditions. As this data becomes available, it will be shared. Thank you.
Thank you, Dr. Leighton. And the final question is for Dr. Walker. Dr. Walker, what is CDC's guidance for post-travel for children? I work at a preschool that goes through the summer, and many families are not following the travel guidance for unvaccinated individuals because they are focused on adults.
Thank you for the question. So we recommend delaying travel until you're fully vaccinated. At any age, if you're not fully vaccinated and must travel, follow CDC's recommendations for unvaccinated people. If you're not vaccinated or not fully vaccinated and must travel, take the following steps to protect yourself and others from COVID-19. Before you travel, get tested with a viral test 1 to 3 days before your trip. While you're traveling, wearing a mask over your nose and mouth is required on planes, buses, trains, and other forms of public transportation traveling into, within, or out of the United States, and while indoors at U.S. transportation hubs, such as airports and stations. Travelers are not required to wear a mask in outdoor areas of a conveyance, like a ferry or the top deck of a bus. And CDC recommends that travelers who are not fully vaccinated continue to wear a mask and maintain physical distance when traveling. Avoid crowds, staying at least 6 feet or 2 meters, about 2 arms lengths from anyone who's not traveling with you. And wash your hands often or use hand sanitizer with at least 60% alcohol. After you travel, get tested with a viral test 3 to 5 days after travel, and stay home and self-quarantine for a full 7 days after travel. Even if you test negative, stay home and self-quarantine for the full 7 days. If you test positive, isolate yourself to protect others from getting infected. And if you don't get tested, stay home and self-quarantine for 10 days after travel. Avoid being around people who are at increased risk for severe illness for 14 days, whether or not you got tested. And self-monitor for COVID-19 symptoms. Isolate and get tested if you develop symptoms. And finally, follow all state and local recommendations or requirements.
Thank you, Dr. Walker, Dr. Leighton, and Dr. Chevinsky. This concludes today's discussion. Thank you, everyone, for joining our call today. A recording will be posted on our Partner Call webpage, where you can find other recordings and information about previous webinars. CDC's Chief Health Equity Unit is hosting a call this Thursday for the National Month of Action for COVID-19 vaccinations. This webinar will highlight organizations who have conducted successful vaccination activities for Black or African Americans and Hispanic or Latino communities. The webinar would also encourage attendees to increase vaccine uptake in these racial and ethnic communities by helping meet President Biden's July 4th vaccination goal. The link is provided on the slide. Please, I encourage you to join and help us reach this goal. Please make sure to sign up for the upcoming partner call announcements to stay informed. We will have our next call in July. I thank you all for joining. Have an excellent day.